Hi, everyone. It's Melissa Griggs, Regional Grant Manager for the Southeast for Learn, Design, Apply, and I am here today with Lindsay, a nurse. She works for a large healthcare system in the Southeast, and we're going to talk a bit today about her experience with telemedicine throughout the COVID-19 pandemic. So, Lindsay, thank you very much for being with us today.
You're welcome. Glad to be here.
Thanks. So, first off, can you just speak a bit about how long you've been a nurse and what your area of expertise is?
Yes, absolutely. So I've been a nurse for about 12 years. The first half of my career, I worked on a cardiac and telemetry unit that specialized in cardiovascular and thoracic surgeries. This second half of my career, for the last 6 years, I've been traveling throughout a large organization and kind of traveling different hospitals, 5 different hospitals, different units that can range anywhere from emergency room, med-surg patients, orthopedics, neurosurgery, trauma, just different units every day.
Awesome. So, Lindsay, can you tell us a little bit about your first experience with telemedicine and what that actually looked like?
Yes, so the first 6 years I never saw telemedicine. I was at a larger hospital, but when I started traveling, I went to a smaller 90-bed hospital, and that was my first experience with telemedicine. The doctors that were in-house were like your hospitalists, your internal medicine, cardiologists, general surgeries, all those were in-house. But if they had a special consult with, let's say, infectious disease, what other doctors was there? The neurologists and your psychiatrists, they all were with telemedicine. So they were in an office somewhere different. And then what it looked like is we had one specific computer that was designated for the telemedicine, for the one-on-ones with the patient and the doctor. So what the doctor would do would set up a time with the secretary to make sure that the nurse was, one, ready to come in with the doctor, but two, the secretary would make sure that the cart was charged, that the stethoscope was plugged up, the speakers were working. We had that designated time that we would come into the room. We would wheel our computer in with us and the patient, and the nurse would perform the assessment on the patient while the doctor obviously would be positioned to see the patient. The stethoscope would be hooked up so he could listen to the lung sounds. And as a nurse, that's why the nurses were the only ones that could use it, to make sure it was in the right anatomical space for the patient. But typically the virtual visit would take anywhere from like 5 to 10 minutes.
Awesome.
But that was my first interaction a couple of years ago with telemedicine.
Great. So, Lindsay, has the current pandemic increased the use of telemedicine in the hospitals you serve? And if so, will you tell us a little bit about how and what that looks like now?
Yes, Melissa, it has absolutely increased. Before, I didn't used to see the telemedicine at the larger hospitals where, especially on the COVID units, I kind of work, throughout all the different hospitals, and on every COVID unit, I have seen telemedicine being used. And that's just to, safety regulations, trying to cut down on a number of times that we, are exposed to the patient. And so the hospitalists are rounding on the computers. And the thing that was different that I mentioned earlier, at the smaller hospital, the nurse, which would have been me, who took care of the patient, would go in with a virtual doctor, where now what they're doing is having one nurse assigned to the virtual doctor. That way, the nurse, the floor nurse, which would be me, would just interact outside of the room with, you'd have the virtual doctor, you would have the RN assigned to the virtual doctor, and then you'd have the floor RN. And we would discuss the patient's care, and then the nurse that's assigned with the virtual doctor would go in and they would assess the patient. But she would go with the cart throughout the whole hospital or to the COVID units. I can't speak 100% to all the units on what they're doing, but I know with the COVID units, they definitely have been increased with the virtual and telemedicine. And I can't speak exactly which doctors. I know the hospitalists were going in. I know some of the nurses were virtual, especially in the ICUs. They have a camera in a lot of the rooms, and the nurses are keeping an extra eye as we're trying to cut down the amount of time that we're in our COVID rooms. So they would always have a camera in the room watching the ICU patients. So a nurse would be watching them at all times as well.
Oh, interesting. I hadn't thought about that aspect of it as well. That's great.
Yes.
So, Lindsay, do you feel that the use of telemedicine that was brought on by the pandemic situation has increased the number of patients that doctors are able to see, or the efficiency with which physicians are able to see these patients?
Yes, absolutely. The doctors, I feel like, are being able to see a lot more patients. One, we're helping them stay safe, limiting the amount of exposure they're having whenever they're going into the patients and out of the patients' rooms. So with the virtual telemedicine, it limits that. Two, I do feel like it's easier to get in touch with these doctors, because a lot of the times when they're in the hospital, they'll be going into a patient's room. Okay, the time it takes to don your PPE and doff your PPE, which is your personal protective equipment, that system in itself, they can't be answering a call if they're in their full gear. So trying to get in touch with these doctors is a lot harder if they're actually in the rooms. But with this telemedicine, I've noticed getting in touch with the doctors, the callback time is only a few minutes, depending on if they're rounding at that specific time. But they call back a lot faster, and it's easier to get in touch with the doctors. I also feel, it's with the patients, because if they want an answer, they like the turnaround process going back to the patients and delivering the message to what the doctor said has increased, and that in the long run patient satisfaction is a lot higher as well.
Oh, that's great. I hadn't thought about that either. You're a
Yes.
wealth of information. So, Lindsay, do you see telemedicine as becoming sort of the new normal within the hospital system that you served, or the increased use of telemedicine is becoming more normal?
Yes, I definitely see this becoming the new normal. I mean, it definitely was a learning curve, as it is anytime there's change. But I have noticed the nurses are becoming more comfortable with it. The doctors are able to see a lot more patients. It's very efficient. It's keeping doctors safe, from exposure. Also, the patients, there's a lot of things that have been virtual on the outpatient world. The patients that don't need to be coming into the office are able, if it's not urgent, they can see these doctors virtually, which has been amazing, because their care does not stop when a pandemic comes. We still need to see these patients, and luckily telemedicine has provided that for them. So I do hope this becomes the new normal, as it's been, shown that it's been very effective.
Awesome. Well, Lindsay, thank you so much for your time. I greatly appreciate it. And we are so grateful for your service and being out there on the front lines. So we appreciate it.
Thank you, Melissa.